For our next session, we actually have a two-part presentation. The first part will be a very brief lecture about ethics by Dr. Kimberly Peer. And the second part will actually move into the room where we ate lunch and do a roundtable discussion. So I really want to encourage everyone to stay for the entirety of this particular session, because on top of learning some new things, we'll actually noodle through some interesting ethical situations that we may or may not have approached in our professional lives before. So do please stay for the whole thing. Some announcements that you've heard before, but I want to encourage you to pay attention to. Remember that you will be emailed evaluations at the end of the day today. Please fill those out. I can't even tell you as a panel how useful those are to us in terms of creating content for the next regulatory conference. So do please fill those out before they get lost in your inbox. So I know it happens to the best of us. Presentations, I believe, are already available online on the BOC website. So if you would not like to squint, if you're like me and you can't see past your nose, then you can actually get those online. Also, please silence all your devices, just because that's polite and it'll prevent any disruptions. So now I will introduce Dr. Kimberly Peer. She's an associate professor at Kent State University. She holds a doctorate in higher education administration with a cognate in healthcare management. Dr. Peer is the editor-in-chief of the Athletic Training and Education Journal, and she serves on the KD Ethics Committee and on the NATA Committee on Professional Ethics. Her national contributions include service to the BOC, NATA, Journal of Athletic Training, and REF in multiple capacities. Her statewide service includes the governor's appointment to the Ohio Licensure Board and over 12 years of service to the OATA. Dr. Peer received the NATA Fellow Award and Most Distinguished Athletic Trainer Award, the GLADA Outstanding Educator Award, the OATA Hall of Fame, the Linda Weber Daniel Outstanding Mentor Award, and the BOC Dan Libera Service Award. She has been lauded with other national, regional, and state level awards for her contributions to the profession and athletic training and education. Dr. Peer has published and presented extensively on the international and national levels about ethics education, and we are very, very happy that she's joined us here today.
So I'm not sure that I can be quite as entertaining on a topic called ethics after that entertaining talk, but I do want to spend about a half hour kind of setting a framework for what we will use when we go into the breakout room and do some dialogue on these cases. I really believe, and not because I'm the only thing that stands between you and the reception tonight, but I think that the conversation that you have with each other in the next room is the most meaningful part of the ethics discussion. And I think that as we grapple with some of these cases and talk about what we know, what we think we know, what we've done in the past, what we've seen done, that's how we start to grow and start to move through ethical deliberation. So it's a privilege to be here, and I want to start and present kind of an interesting framework, if you will, for looking at ethics. And this 5 Minds for the Future is really something that can be used across disciplines and across settings. And when we start to talk about, anytime we start to talk about ethics, people start to say, well, you know, I get that doing the right thing is important, and I believe I do the right thing. But we really don't connect it oftentimes to quality patient care. And this model really reflects quality patient care. It is about the technical skills that we bring to the table. We've talked about that a lot. We have certification, we have all of those educational preparations that give us those technical skills, continuing ed that continues to refine and develop our technical skills. We clearly understand the evidence-based practice piece, clearly evolving now even more than in the past. But what we seldom talk about is the ethical decision-making piece of that quality patient care model. We think that we would automatically do what is right and good, because ethics, by definition, in its most simplest form, getting out of all the theory, is doing what is right and good. And in healthcare, that's what's right and good for the patient. I mean, patient has to come first. But we seldom contextualize that ethical decision-making, and we say we're good people, we do good things, so we just don't need to talk about it. I've been working for over a decade to get people to talk about it and to listen to it. And I know there's science out there that says that there is ethical decline in all healthcare professions, and we need to do something about it. The cases that come to the COPE, the cases that we're seeing, the press releases of inappropriate behaviors are reflecting that there is a decline. And if we don't start to integrate that into the quality patient care model, then I think that as a profession, we will not make the strides that we are working towards. So this model that is really interesting for me is this 5 minds for the future. And Howard Gardner talks about how we can't think like we used to think. The future looks very different. And as athletic trainers, we've said we can't predict the future. We heard that when we talked about writing rules and regulations, where people said, you know, we couldn't predict the future, so we had to just kind of be general. We can't predict the future, so we have to keep it broad. And so what Gardner says is that in education, in healthcare, in patient care, in life in general, that the future preparation of anyone, healthcare providers in our case, has to look a little different than what it did in the past. And I think Dr. Merrick alluded to that this morning in his talk, that education will look very different, not just by degree title or degree level, but in general, very different. So Gardner says that when we talk about the 5 minds for the future, and as we prepare professionals to make healthcare decisions for patients in whatever setting they work in, we have to look at 5 different spheres. And he says that there are 5 different areas. We have the cognitive mind, the synthesizing mind, and the creative mind. Those are the kind of the intellectual, the cognitive spheres that we need to focus on. And then he talks about the 2 human relations spheres, and that is the respectful mind and the ethical mind. Clearly, my job today, in really what I've focused my career on for over a decade, has been that ethical mind. But I want to give you a little background on the first minds first. So the disciplined mind isn't just the discipline. Most often in any healthcare profession or educational program, you say the discipline is your content area. That's your specific discipline, specific knowledge, those skills and knowledge and affective pieces that you want people to know when they get out of your programs. But the disciplined mind goes beyond that. It isn't just that content expert. It's having the discipline to be a lifelong learner and to change in our case, a rapidly changing healthcare environment. So that disciplined mind isn't just about athletic training, knowledge, and skills. That's really important. The synthesizing mind really is about putting it all together. But what I like about this when I talk about ethics is that it says, decide what is important and what is worth paying attention to. Oftentimes when we try to put things together, when we try to synthesize cases, and we see this when we look at cases through the Committee on Professional Ethics at the NATA, there's some things that are totally irrelevant that get brought into the case, and there's certain things that are really important that we need to pay attention to, but we have to dig for. So we need to make sure that what we're looking at is truly important and relevant. And we also need to make sure that it makes sense not only to ourselves, but to others as well. So when this morning we were talking about writing disciplinary action for breaches in regulatory pieces, they said that it has to be written very well. It has to be specific in the sense that there is some ramification for an action that happens. But if it doesn't make sense, and it is so loosely written that it can be interpreted a million ways, it doesn't help us either. And so we have to find that middle ground. So the synthesis piece is very important. The third cognitive mind is this creating mind. And in ethics, this is particularly important. We function in athletic training in an environment where we like doing what is comfortable and what we have done in the past. Change is, and you can ask, a lot of the agencies that are sitting in this room, change is met with a lot of resistance oftentimes. But we have to be able to think differently. We have to be able to be creative. We have to look at situations through very different lenses. I think from an ethical perspective, most people put it on a dichotomy of saying, well, it's either, if it's illegal, therefore it must be unethical. And I'll show you a grid in a bit that's not necessarily always the truth. And that we have to be able to think differently and be creative when we think about these ethical situations and the resolution or the ramifications of those actions. So the creative mind, in my opinion, is one that's really underutilized in our profession. I think we're starting to see change. I've been in the field for close to 30 years, and I think we're starting to see more of that breaking the mold and thinking differently. So I'm very encouraged by that. But that's been a long, hard battle and a long road that we've traveled. And so we need to continue to develop that. I also think that in athletic training particularly, that we oftentimes believe that we are practicing with empathy. So the respectful mind, according to Gardner, is that one that really has an appreciation for differences, really tries to demonstrate respect. But in showing empathy, we may not be demonstrating justice. And if we're not demonstrating justice, does that mean that we're unethical? I mean, justice is one of the prima facie healthcare principles. It's one of the ethical standards that goes across all medical disciplines. But justice isn't the only prima facie healthcare principle. There is autonomy, where the patient has the right to choose. There is beneficence, which is doing good. There is non-maleficence, which is doing no further harm. And when we try to figure all those out together, oftentimes people in healthcare err on the caring side or the empathy side. That's not necessarily developing that respectful mind, because exceptions oftentimes create challenges when you're in a regulatory environment. And then lastly, the ethical mind. The ethical mind clearly is one that I've studied the most and that I'm most passionate about. And I think that as we develop the ethical mind, we have to get past the construct that somebody is trying to tell you what is right and what is wrong and how to believe or how to act. Regulation, codes of ethics, those types of things lay out the frameworks. But I'm not going to tell you you're a bad person. I'm not going to try to tell you what you have to do. That's anchored in personal, professional, and organizational values, as well as regulatory documents that guide our behavior. So it isn't about someone saying that because I teach ethics, that I'm always right and I'm going to teach you how to be just like me. I don't want to teach you how to be just like me. I want you to be creative and look and interpret and synthesize and make a strong decision. Because ethics education technically isn't about making you ethical, it's helping you make better decisions. And so that's why there's been a push lately. I mean, the BOC has been running ethics blogs, and we've been doing this at the regulatory conference, and we speak at the NATA and a lot of the state conferences. Because we want people to start thinking, not because there's this perception that you're bad or doing wrong. It's just that we need to think differently than we did in the past. I mean, I know I'm not a program director anymore, but when I was a program director, some of the stuff that came to me that our students were doing 20 years ago, I would have never thought that students would try to pull that. Things that I see at the board level, the licensure board level, or things that I see come through the Committee on Professional Ethics, I think, gosh, I would never think people would do that. But we need to start opening our eyes and seeing that. But what I want to talk mostly about on this slide is that we're responsible not only for what we do, but for what we don't do as well. And I think that a lot of people today have talked about the importance of reporting and the importance of compliance with regulatory documents. And what is our obligation? What is our ethical obligation, even when it comes at considerable or potential loss to ourselves, to report unethical behavior? And I think that most people say, it doesn't affect me, I don't have to do anything about it. Or I'm not the one doing it, so I don't need to be concerned about it. And that continues to deteriorate the profession. We have to be responsible for doing the right thing, even when it's difficult to do that. And I think that reporting, especially in a profession where we're typically very close-knit and we kind of have each other's back and we've kind of come through the trenches together, I think that's very hard to do. I think that's changing, but I know that the number of cases that we see through the Committee on Professional Ethics certainly does not reflect all of the inappropriate, unethical behaviors that are going on. I'm not saying that we have to go around and try to catch people doing things, but what I'm saying is if it is harming our profession, the only way to move forward is to dig deeper and do that, even when it comes at what I would call a personal loss or personal risk. And that's hard to do. So when we look at cases and we think about case deliberation, I think it's important that you think about it on kind of a continuum. And we know that our personal values should be reflected in our behaviors, and we all develop our personal values through different avenues. It could be through your religious upbringing, through your culture upbringing, through your family. Many things shape your personal values. Your experiences clearly do. But where the challenge starts is as we move into a profession, so we're athletic trainers, and we have this professional discovery where we have professional values, and we have this discovery process of what we can do and what we can't do. We have regulatory acts telling us what we can do. We have a certification agency. We have an educational agency. So this professional discovery is a challenge, okay? Because it brings together a lot of different pieces. And in our profession now, we're starting to feel people jumping ship because they're saying, I don't feel comfortable with where athletic training is going, or I don't feel comfortable that I can't bill for services in a clinic, so I'm going to go get a PTA certificate or PTA license so that I can do that. And that's when there is this conflict between what you believe you should be able to do and what the profession identifies as your scope of practice or the regulations that you can practice under. And then where most people who stay in, they're aligned with their personal values, aligned with our professional values, and they get in an organizational culture where they're pushed to do things or encouraged to do things. I shouldn't say push because it's a choice, where they're encouraged to do things that go against what they believe aligns with their professional values, and they do it anyways to keep the peace in the organization, to keep their job, to get the promotion, to get more money. And I think that organizational discovery is the greatest challenge. I tell my students in every ethics class that I teach, if the organizational values do not align with the professional values and or your personal values, find another job. Because you will be put in a difficult situation where you will make a bad decision at some time. You will. There's too many pressures, and most people can't stand up to that. And so that's kind of the continuum when you start to think about, because, you know, I sit there and I say, well, why would someone do that? When they bring some cases to us, I think, why in the world would somebody do that? But when you go through those different minds of why people might have chosen to do that, it starts to make a little bit of sense. But if you are in a situation where your values, where your values conflict, you will make bad choices. Your values are reflected in your behaviors, okay? So there's this concept called moral courage, okay? And this gentleman named Rushworth Kidder, he passed a couple years ago, but he ran this Global Institute on Ethics, did some amazing work. But he basically said, listen, all of us are probably really good people. Most of us are really good people. We all know what the right thing to do is. Where we fall short in ethical decision making is when we don't stand up for what we really believe in. We lack moral courage. Sometimes it's just easier to go with the flow. It's easier to just keep the peace, to not try to swim upstream. And when we don't demonstrate moral courage, we typically make really bad ethical decisions. We know, we've processed, we've gone through the entire ethical decision-making process, and we know what the right thing to do is, but we fail to stand up and do the right thing because it might impact my income. It might impact my promotion. It might impact the culture at work. My colleagues might think that I'm, telling on them, or that I'm judging them. It is a really powerful force. But if you have the opportunity to read it's a good, easy summer read, but Rushmore Kidder wrote a book called Moral Courage. It's a phenomenal resource. And it's simple, and it talks about some really cool things that happened in the world where really great people made bad decisions because they lacked the moral courage. And they knew it, but they didn't develop that courage. So moral courage is really important, mostly because it helps us kind of wait to get that gratification. We don't get so influenced by peers, and in a profession that's very peer-oriented. I mean, this is a brotherhood and sisterhood, I think. I've been in it, like I said, almost 30 years. I have some very dear friends in the field, and people have each other's back. But it really does help us get independent in our thought. It helps us get away from that peer pressure. It helps us really start to think about being a little more comfortable when it's a little ambiguous, you're not sure of all the facts, but it encourages you to dig deeper then. And also to not be afraid of taking risks. If the right thing means digging your heels in and standing like a rock, then you need to display moral courage and stand like a rock. You might not be the most popular person at the time. That's that deferred gratification. But in the end, you will feel the benefits. So my students, my young students, okay, undergrads and graduates, they're all young to me now that I've peeked over that 50 hill. But so they really worry about peers, what their peers think in their program. I mean, they really worry, especially the freshmen, being liked by people. My grad students, as they get into their latter years of graduate school, they really start to get that independence of thought. I don't think that that happens only, though, because you get older or get more experience in the field. I think it has to be a purposeful, deliberate activity where you develop all 5 of those minds and you purposefully deliberate on the ethical dilemmas that are facing you. But I know one thing. I know that as a profession, we cannot continue to think that what we are doing now from an ethical perspective will move us forward in this healthcare market. We have to do something differently. We have to teach our students, we have to teach our professionals that we are all accountable not only for what we're doing, but for what we're not doing too. And if there is inappropriate, unethical behavior going on out there and we aren't reporting it, that we're just as guilty as the people who are doing it. I think we are at a really critical time in our profession, and it's a very exciting time, like Dr. Merrick said this morning. But it is a critical time for us. And I think that this concept of promoting ethical behavior and getting outside of the yeah, well, I kind of knew that was going on, but it really didn't affect me mentality. We have to get past that, or we're not going to advance. The literature in the medical field talks a lot about this moral decline and empathy decline in the healthcare professions. And a lot of that is because we have truly gone to the socialization model of ethics education. We really believe that, through exposures to clinical preceptors or through exposures to whomever that we're working with, that we will just learn the right thing to do because they're upstanding professionals and, they're good preceptors according to our checklists. But what we're finding, and the literature is rampant in medicine, in PT, in dentistry, in pharmacy, is that perhaps what our students are learning and our young professionals are learning is how not to do the right thing because they're in an environment of fear, and if they report it or say that so-and-so is doing something, and that's a subordinate superior relationship, that it will have negative ramifications. But what we know from the literature is that if you are exposed to that behavior over time, you will start to adopt that behavior. And you'll say, it's okay to do that because John does it and he's my boss and he never got caught, so it must be all right. I think John's an upstanding healthcare provider. So this moral decline is something that really, in my opinion, is one of the most frightening evolving pieces of literature relative to ethics education. We have to start to talk about that. We've got this transition to practice piece that everyone is talking about in athletic training education. And part of that transition to practice is having that moral courage to stand up and do the right thing, even when the risks are high. And that's all about ethics education. So I think that we have to get really comfortable with perceptual differences. Like, we have to be able to agree to disagree. And the only way that we're going to be able to do that is to talk about cases, to say, well, no, to me it's really clear. They shouldn't do that. I mean, we just saw that in the poll where half people raise their hand, yes, half people raise their hand, no, sometimes, whatever. But we have to get comfortable with that. We have to be able to talk about it. Most people don't want to talk about ethics. I mean, we've been fighting this for over 10 years, and people are like, I'm ethical, we don't need to talk about it, that's soft science, we're all good, let's just not talk about it. But then we see the cases coming forward and coming forward and coming forward, and clearly there is a gap somewhere. So we're going to start talking about it. And we're going to talk about it here in about a half hour in the other room about interpreting cases and looking at different perceptions and looking at those areas that are a little bit gray, because that's what that ethics is all about. We do have good guidelines. The BOC has the standards of professional practice that guide us. The NATA has the code of ethics. And clearly what the conference is this weekend is also about the state regulations and the acts that guide us. But those aren't these documents will not make you behave ethically. They won't. And if you don't get caught, you probably won't ever change, right? I want to read something off the Code of Ethics. And I do a ton of work for the NATA. I'm on their Committee on Professional Ethics. But the preamble to the Code of Ethics always just, it's interesting to me, okay? Because this is supposed to allow us to have guidelines and something that's codified, something that should really be the cornerstone for how we act if we are a member of the NATA. Of course, if you're not a member of the NATA, you can do whatever you want, right? Because this is the NATA's code of ethics. You know, my students raised that question one day and I never thought of it. They said, so if we're not a member of the NATA, do we have to, follow the code of ethics? And I'm thinking, well, not exactly, but the Standards of Professional Practice has the code in there too. But so here we go. So it says the principles do not cover every situation encountered by the practicing athletic trainer, but are representative of the spirit with which athletic trainers should make decisions. These principles are written generally. The circumstances of the situation will determine the interpretation and application of a given principle and of the code as a whole. When conflict exists between the code and the law will prevail. So even though we have a well-developed code, and the Standards of Practice has a professional responsibility piece in there, they have a nice little preface in there too that says these are guidelines, but that does not make you behave ethically. Every time we speak at a national conference, Gretchen and I, my colleague and I that do most of our work together, we ask people how many principles are in the NATA Code of Ethics, and most people have no clue. When you renew your membership, you say that you will comply with them. You should at least know generally how many there are, right? So again, I think that this legal ethical piece is a false dichotomy. I think that there is a whole lot of gray in the middle of those two. And that's what we're going to grapple with a bit in the cases. So I think that starting discussion about people's behavior, ethical behavior particularly, because there's some kind of a character, I don't know, some character piece that falls in that makes it a little bit uncomfortable for people. It really is important. It is really important to start to talk about this, not to judge and say you're not a good person or you're not doing the right thing, but what guides our behavior, what are some of the options, and what should be the resultant action. And you're going to see that people see these cases through very different lenses, despite having the same documents to look at. And that's that ambiguity. So again, I think we have a powerful impact on the profession if we don't start to really look closely at the ethical behavior. We are one of the very few, probably one of, I don't want to say only, but one of the very few healthcare professions, predominant healthcare professions, that does not have explicit professional core values articulated to its members to guide their behaviors. One of the very few. That should go back because your values should reflect your should be reflected in your behaviors. So if you don't clearly articulate your values, how can you expect certain behaviors, right? So again, that's confounding to me. But what we're going to do is we're going to look at these cases. Hopefully we're going to look at them differently, and we're going to think something different than what the guy and gal next to us is thinking, and we're going to talk about them. So when we get to the roundtables, you'll have a little break after this, but we're going to, we have all the cases on the tables, we have the code of ethics on the table, and the standards of professional practice on the table. Once you sit down, I'll come around and I'll tell you which case you're going to look at, all right? So your table will be looking only at one case. You'll spend about 10 minutes discussing the case. You'll look at the code of ethics. You'll look at the standards of professional practice and see if there's, and if you know your state regulatory act, if there's something in there that is blatantly a violation. You'll talk about what the options might be for resolving this ethical dilemma. And then you'll choose which is the best decision, and then we'll debrief. We'll go around and for 5 minutes at each table, we'll debrief with the whole group. So you'll hear all 5 cases, but your group will only really be deliberating on one for the sake of time, okay? So when we break here in a minute, I think you have about 10 minutes, because I went over a little bit. About 10 or 15 minutes. You're going to head back into, what's the name of that room back there? The Winnebago Flanagan room where we had lunch. And you're going to just sit down at a table. I'll come around, assign your case, and we'll get rolling right away. We only have about an hour and 15 minutes to get through 5 cases, so we need to get started on time. So please pay attention as you're out in the hall mingling to get back in within that 15 minutes. All right, thank you.